Blankovich, thank you so much for joining us. And tonight we have a special guest with us, a patient of ours, and we're going to dive a little bit into her journey. Alexandra, thank you so much and welcome.
Thank you for having me.
I feel like you're part of the family here.
I do too. So about 9 years ago, I weighed about almost 300 pounds. I'd just gotten married and was finally in a place in my life where I was truly happy, you know, just emotionally ready to, you know, be happy in all aspects of my life. So
I tell you, this always amazes me to hear this story. So let's just go back and highlight that. You were just under 300 pounds.
Yep.
You lost 130 pounds in total. And so what period of your life were you overweight?
pretty much since I was a child. I definitely was an emotional eater. That was like the way that I would, you know, like comfort myself, what I would, you know, didn't make good choices, would go on diets and things like that throughout my life prior to having lap band. And unless I was really strict with it, didn't deviate, was at the gym all the time and cut everything out, I would lose weight. But the second I stopped being super, super strict, it would all come back on and then some.
So a lot of yo-yoing up and down, but always significantly overweight.
Yeah.
Okay. Okay, so you had a bariatric surgery, and bariatric surgery has advanced quite a lot in the last, really the last 15, 20 years. We've done most of it laparoscopically.
I would say if it's something you've truly struggled with your entire life and you're ready to make a complete life overhaul, I mean, it is not a quick fix. It's not a easy out. It's not, I mean, it's work. You do all the same work you do without having it done. It's just an extra tool in your belt.
It's a tool.
Yeah.
Okay, that video is up. So here is some of the Snapchat story from your surgery. There's tissue removed from the back. What do you think as you see this?
It's pretty amazing. I mean, I think it really puts into perspective how much extra there was that had been there for years and wasn't going anywhere.
And now you saw this story kind of in real time after surgery?
The night after surgery. Yeah, I watched it kind of out of it, but I watched it recovering.
Yeah, stayed overnight here in the surgery center. What was that experience like?
Amazing. I mean, your night nurses were like, it was like my mom taking care of me, you know, making sure I had everything I needed, spending time with me and just hanging out and watching TV so I wasn't alone, you know, comforting me when something was really hurting and just reassuring me that, you know, you're going to get through it, it's going to be fine, you know, you're going to come out on the other side of this and you're going to be ecstatic. I
think we even have a clip of that. In fact, Clayton's got that clip showing. Here's Pam doing cupping. Now she's at 6 weeks post-op. You can see that earlier in the clip was just a couple days or first week post-op. You can really see that shape. Things are really coming in, and she's suctioning tissue up into the cups, going through education on the importance of, well, dietary stuff, salt in the diet, right? She didn't happen to mention that, did she?
Oh, yeah, no salt.
Every visit. And this is an integral part of it, is to give you the tools and the help to appropriately recover in the best way possible. And so how far are you now?
I'm about 6 months out.
A little bit less than 6 months, right? And what would you say was that time frame where you felt like, you know what, this is pretty much behind me. I feel pretty much like I can do what I want. My energy is basically back. I am myself again.
I would say about 8 weeks. I mean, it's been completely life-changing, and it's amazing to see, like, once you lose that amount of weight, I mean, there's the payoff in what you look like in clothes, but the payoff's not there when you don't have the clothes on. And so being able to stand there in the mirror without clothes on and be totally satisfied with the way that I look now and being able to see all that work pay off and what was underneath all of that is pretty surreal. I remember the first time I looked in the mirror after I came home and I was just like, I was floored. I was like, who is this? Like, this is amazing.
You've never seen that person.
No, ever. But again, to have realistic goals, because I think the thing that I'm noticing with other, not your patients, but just patients who have had things like this done, is they have this done and then they get nitpicky. And
absolutely.
Yeah.
And can we, okay, so these are your, you want to comment on that? So this is what was under your clothes.
Yes.
What do you see when you see these?
Just the damage that I did to myself from all those years of not being happy. And I think the biggest thing that like my friends and family would come back and say to me after they saw the surgery was, we had no idea that that's what you were hiding underneath your clothes. And I didn't wear a binder. I didn't wear, you know, if it was like date night, I would wear Spanx. But like on the normal, I wouldn't. And people had no clue that that's what was going on underneath my clothes. It's an amazing feeling to not have that tethered to you. Like I was telling Haley at one of my scar treatment appointments that like yoga is easier. Like everything is so much easier to do, you know, chasing after my kids. I'm more flexible. It's just all because there's not that chunk just
that extra stuff flopping around. Yeah.
For sure.
Yes. Thanks for joining us. I'm Nick Slankovich, DenverBodyDoc. Good night and definitely enjoy your journey.